I received fairly limited specialist care while I was in a general ward in terms of in specific relation to perinatal care. So my admission was a couple of years ago, and it was before the establishment of the Perinatal Infant Mental Health Service. So there wasn't that facility that I could have been referred to, which could have been quite beneficial in my case.
So I think it's really important that we take into account a consumer being pregnant or the parent of a new baby when we're considering the assessment and care planning process right from the very beginning. And I think in order to do this well, we need to take a really curious stance and look at what's actually going on for that woman and her family. It's very easy sometimes to get caught up in just looking at the risk or child protection aspects of parenting when we have a consumer admitted in this period. But actually many families have a lot of strengths and supports that we can tap into, and if we're able to do that well, we can really support the recovery for that woman and family. When we're thinking about care planning for parents in the postnatal period, we're really looking at a variety of things, from some of the physical health needs that are associated with that immediate postpartum period. Breastfeeding, expressing and weaning needs for a mother who might be separated from her infant. And also, obviously, contact with her baby is a key factor.
So one of the most important things that I think about when I'm assessing an expecting or a recent mother is that looking after a mother is looking after a woman in and of itself, but it's also thinking about that mother-child relationship. And so that's why sometimes the assessment can take a little bit longer, and that's why the assessment and the care can sometimes need a little bit more complexity, because not only do we have to look at the patient, look at the individual, but look at the family and look at the attachment and how we can prevent adverse health, social, cognitive, developmental outcomes for the child.
I think if there had been an opportunity for support services that could really link in and enhance that communication with all of my family, any supports particularly that could assist my husband. He went through a very difficult time during this period, so if there had been services for his mental health to support him, as I mentioned earlier, the Perinatal Infant Mental Health Service could have been very valuable, especially in terms of providing link-ups and communication with my family. Perhaps access to a peer worker or someone who could come and just provide that little bit of support. Because I was on the unit and there were no other mothers there, there were other people experiencing their own mental health challenges, but just having someone who could understand the nuances of what I was going through, that could have been really helpful as well.
When somebody in the perinatal period is admitted to hospital, as a nurse, your scope of caring for them automatically shifts from caring for just one person to at minimum 2 or 3. So we're always looking at any decisions, any care, any activities, any adjustments to their treatment. It starts with the consumer, but it always needs to involve the perspective of the infant or the small child and the carer as well, so the other parent, if there is one, or the person who's looking after babe while mom's in hospital. We also look at providing therapeutic activities or therapeutic interventions, and I think a lot of the time for perinatal women, those come in the form of one-to-one. So some of the groups around medication, some of the groups around recovery are generalized, but what we know is that perinatal women are having a really individualized experience in hospital, and often they might be the only one in the unit who is in that perinatal period.
Specialist clinicians such as perinatal and infant mental health clinicians, our statewide outreach perinatal service, or SWAPs for those people in rural and remote areas, lactation consultants and perinatal psychiatrists where we've got them, can be incredibly helpful in supporting inpatient staff and consulting around specific PIM issues. So it can be really helpful just to get advice from other professionals around specific issues, particularly things like breastfeeding or engaging with infants, and that can also help in making a comprehensive discharge plan for the family.